Hi, my name is Annette Cody. Welcome to the first in a series of 3 YouTube videos developed as a part of this course on infection control principles and isolation precaution practices. As new healthcare workers, it is important to understand these important principles and be able to apply the practices to prevent the transmission and spread of infection. Infection control and prevention is everyone's responsibility. The objectives for this first part of the course will be to define infection control, identify the components of an infection control program, and identify your role as a healthcare professional in preventing nosocomial or healthcare-associated infection. What is infection control? Infection control is the discipline concerned with preventing nosocomial or healthcare-associated infection. It is an essential part of the infrastructure of healthcare. What are the components of an infection control program? Infection control addresses factors related to the spread of infections within the healthcare setting, whether that be from patient to patient, from patients to staff, and from staff to patients or among staff. It includes prevention, hand hygiene, hand washing, cleaning and disinfectant and sterilization of the environment as well as medical equipment, vaccination of both patients and staff, and surveillance. Monitoring and investigation of demonstrated or suspected spread of infection within a particular healthcare setting, including surveillance and outbreak investigation, and management, interruption of outbreaks. It is on this basis that the common title being adopted within healthcare is infection prevention and control. What is the role of the healthcare professional in preventing nosocomial or healthcare-associated infections? As healthcare professionals, it is important to know the infection control policy and procedures, hospital-wide and service-specific. Compliance with the expected practices of infection control, including isolation precautions, use of personal protective equipment, and hand hygiene. And a culture of safety, stopping the line. If you see something or hear something that isn't right, stop the line, talk about it, report it if necessary, and take the precautions required. Reporting concerns of breaches in infection control and holding each other accountable for compliance with infection control. It's okay to ask, have you washed your hands? There are many regulatory bodies and additional resources available to learn more about infection control principles and isolation precaution practices. The Joint Commission and the National Patient Safety Goals, the Center for Disease Control, Healthcare Infection Control Practices Advisory Committee, the Society for Healthcare Epidemiology, Infectious Disease Society of America, and the Association of Professionals in Infection Control are but a few of the regulatory bodies and additional resources available. It is your responsibility as healthcare workers to become familiar with some of these regulatory bodies and utilize the additional resources available for you. Throughout this course, in the other 2 sections, we will be learning about some of the precautions and practices in infection control. Hi, and welcome back to the second part of this course of infection control principles and isolation precaution practices. In this section, we will be discussing isolation precautions, including standard precautions and transmission-based precautions, and the standards and requirements for each of these types of precautions, and the use of the personal protective equipment that goes along with each of the types of isolation precautions. What are standard precautions? Standard precautions, previously known as universal precautions, are the basic level of isolation precautions. The purpose of standard precautions are to reduce the risk of transmission of bloodborne and other pathogens from recognized and unrecognized sources to a susceptible host. They include hand hygiene, use of personal protective equipment, respiratory hygiene and cough etiquette, and safe injection practices. Transmission-based precautions. Transmission-based precautions are additional infection control precautions used for patients who are known or suspected to be infected or colonized with infectious diseases. These precautions are based on the route of transmission of the microorganism. They build on standard precautions and include the use of hand hygiene, personal protective equipment including gloves, gowns, and masks as needed, and the placement of the patient into a private room. Contact isolation is used with patients with microorganisms known to be transmitted through direct or indirect contact with the patient and their environment, and include the use of PPE. Droplet precautions include the use of surgical masks within 3 feet of a patient due to large respiratory droplets. Airborne precautions call for airborne infection isolation room with negative room air pressure relative to corridors, air exhaustion directly to the outside or recirculated through HEPA filtration with 6 to 12 air changes per hour. Personal protective equipment. Because unsuspected infectious agents may be present in blood and all body fluids except for sweat and on non-intact skin and mucous membranes of all patients, hand hygiene and personal protective equipment, including gloves, gown, mask, eye and face protection, should always be used if contact with these substances is likely. Personal protective equipment serves as a basis for standard and transmission-based precautions. There are recommended procedures for donning and doffing PPE. Please find below the link for a YouTube video that demonstrates the proper procedure for donning and doffing personal protective equipment. The final section of this course, in Infection Control Principles and Isolation Precaution Practices, is on hand hygiene and proper hand washing technique. Why is hand hygiene important? Hand hygiene is the single most important practice to reduce the transmission of infectious agents in the healthcare setting. What are the different methods of hand hygiene? There's hand hygiene with soap and water, and there's hand hygiene with alcohol-based hand sanitizer. Use soap and water for hand hygiene when hands are visibly soiled, before and after eating, after using the restroom, or after care of a patient on isolation for Clostridium difficile or norovirus. Use hand hygiene with alcohol-based hand sanitizer of at least 60% alcohol, before and after direct patient contact, before donning sterile gloves, before inserting invasive devices, after contact with patient's intact skin, after contact with objects and equipment in the room, and when moving from a contaminated body site to a clean body site during patient care. Hand hygiene techniques. The use of proper hand hygiene techniques is essential to prevent the spread of infection. When using soap and water, wet your hands, apply soap to a lather, and rub all surfaces of your hands, including your thumbs, your palms, and between your fingers. Scrub all surfaces for 30 seconds or for the amount of time that it takes to sing Happy Birthday 2 times. Rinse your hands, being careful not to splash, and use clean paper towels to dry your hands. Use a clean paper towel to turn off your faucet. When using hand sanitizer, apply a quarter-size amount of gel into the center of the palm of one hand. Rub all surfaces of your hands, including your thumbs, palms, and between your fingers. Rub until all surfaces are dry. Here is a link to a YouTube video on proper hand hygiene technique with soap and water. Throughout this course, you have learned about infection control, the components of an infection control program, and the role of a healthcare professional in infection control, isolation precautions, including contact, enhanced contact, airborne, and droplet precautions, the proper use of personal protective equipment, and the importance and techniques for hand hygiene. This video puts it all together in a thought-provoking YouTube video that demonstrates why it is important to break the chain of infection. I hope you have enjoyed this class, and please remember, infection control and prevention is everybody's responsibility.